Tuberculosis remains one of the world's leading infectious disease killers. The USAID says that before COVID-19, the most destructive pathogen on the planet was Mycobacterium tuberculosis, the bacterium that causes TB. Despite being preventable, treatable, and curable, this ancient disease continues to kill more people each year than HIV and malaria combined. In the recent 2023 Global Tuberculosis Report by the World Health Organization, a total of 1.3 million deaths were recorded, including 167,000 people who were infected with HIV. Globally, 10.6 million people contracted the TB infection worldwide, of which 55% were men, 33% were women, and 12% were children. 8 countries accounted for more than 2/3 of the global total: India, Indonesia, China, the Philippines, Pakistan, Nigeria, Bangladesh, and the Democratic Republic of the Congo. In 2019, the DOH has reported that the Philippines ranks 4th worldwide in tuberculosis incidence, where about 1 million Filipinos have active tuberculosis, and where nearly 70 Filipinos die every day from this disease. So if tuberculosis is a curable disease, why is it still around? This is the story of Miguel and Lola Nena's fight against TB. 12-year-old Miguel from Parañaque City always wanted to become a doctor when he grew up. He lives with his Lola Nena, who raised him most of his life. And so it was natural for him to take care of his Lola whenever she got sick from simple colds or fever. Except, today Lola was coughing very hard, and nothing that Miguel did seemed to help. Miguel also noticed that Lola Nena had been coughing for a while and ate very little during meals. Worried, Miguel convinced Lola Nena that they would go see a doctor for help the next day. A nurse takes Lola Nena's vitals and begins asking her questions. They found out that Lola Nena's cough had been non-stop for 2 weeks, a cardinal sign of TB. Lola Nena's doctor, Dr. Cheryl, explained that tuberculosis has 4 cardinal signs or symptoms in adults: at least 2 weeks duration of cough, unexplained fever, unexplained weight loss, or night sweats. She explained that TB was highly infectious through small droplets in the air, and recommended that close contacts, including Miguel, should be under observation too. She explained that TB is a curable disease but has not been eradicated completely, because aside from being very difficult to screen for infections thoroughly, there are also instances where the bacteria becomes immune to our current medication. This happens when TB patients interrupt, do not follow, or do not complete their TB medication for any reason. There is also the stigma that comes with TB misinformation. Dr. Cheryl thanked Miguel and requested his full support so that Lola Nena can complete the TB treatment. Miguel and Lola Nena both underwent the gene expert test. It was a quick and easy, on-the-spot sputum collection to check for the presence of the TB bacteria. After a few days, the results came and Miguel was thankfully not infected. Lola Nena, however, was confirmed to have the TB infection. But by placing their trust in the TB DOTS, or Tuberculosis Directly Observed Treatment short course system, Dr. Cheryl assures Lola Nena that she will be able to make the path to recovery. Lola Nena would complete her treatment in 6 months. She never missed a medication, nor a scheduled checkup thanks to Miguel's support. She recovered from TB and lived a longer, healthier life. Today, over 75 million lives have been saved since the year 2000 due to the combined global efforts to combat TB. However, challenges such as the drug-resistant TB variants and the overall financial capacity required for TB diagnosis and care remains a public health crisis. Additionally, it is estimated that only about 2 in 5 people have access or are aware of available TB resources. In 2023, The SeeYouDoc TB Module, funded by the USAID Philippines, is a TB platform developed to digitize the standard TB cascade of care. It aims to shorten turnaround times and make TB services more accessible for Filipinos at the privacy of their own home. Starting in Parañaque City, patients can now avail free TB services from participating facilities by signing up for a SeeYouDoc account, getting verified, and then answering a quick TB screening survey. Responses from patients are then screened by the medical network and endorsed to a local barangay facility who will be responsible for providing the TB cascade of care to the patient through a care plan. The screening responses are used by the doctors to save time by shortening the interview questions. Diagnostic tests such as the Gene Expert can be requested through creating service requests or referrals. Prescriptions made within the platform can also be adjusted or printed. The TB module also features a dashboard to get a quick overview of the medical network's fight against TB in terms of patient case statuses and turnaround times. This report can also easily be extracted or printed for further analysis. Dr. Miguel is now a board-certified physician at SeeYouDoc. Recalling his grandmother's fight against TB, Dr. Miguel is excited to introduce innovative solutions like the SeeYouDoc TB Module to help his community fight for a TB-free Philippines. Learn more about the SeeYouDoc TB Module by visiting our website at www.seeyoudoc.com.